Welcome. Would you introduce yourself?
I'm Gabe Lohman, father of 4, married to my beautiful wife, Jessica, and
Patient, loving.
that's right. From North Fern, Indiana, basic office manager of an electrical company, basic 7:30 to 5 o'clock job, nothing too terribly special, but yeah, that's me.
What brought you into the clinic?
I wanted a lifestyle change. I didn't want a quick fix, a pill, get through the day type thing. I wanted to change kind of where I was and where I was heading. So first off, diet has been the most important. Secondly, after you lose some weight, you feel like doing more. And thirdly, just making sure the insides are matching with my outside. So I feel happier, I feel better. My attitude and focus has changed for the better. Now my insides, seeing the blood work get better and different things like that, it's just more motivation to continue.
And so speaking of weight, where were you and where are you now?
I was at 274. I weighed myself this morning at 220.
And so what symptoms were you having in all of this?
So the main thing was probably sluggishness, and just kind of just a pain all the time in my body, and due to the second round of blood work that I've taken, my inflammation numbers have gotten a lot better, and I can tell. I could have told you that before I even got the blood work back. So that's probably the biggest thing.
Well, and you're layering, as I was saying, you're layering in all those healthy habits and hence the healthy outcome.
Right.
And so, aesthetics are shallow, but we all still care about them.
Right.
With that being said, what can you do now that you couldn't do just a few months ago?
Breathe going up and down stairs. Focus on what people are saying better. I mean, it is absolutely amazing, the focus that I have now in comparison to 100 days ago. But I would say just I don't snore at night anymore, which is amazing. I've touched on that before, but that is the breathing thing. I mean, it is absolutely amazing how much better I breathe, and I can breathe through my nose even when I'm working out or walking, where I was just, trying to catch my breath all the time before. So.
Been there myself. I know exactly what you're talking about. Lips cracking all the time.
That's right.
Always got a drink in your hand.
That's right.
So, with that being said, I'm going to add in again here that you've been a stellar patient. You've done the work, and that's why you've gotten the payoff you've gotten. But is it worth it to you?
Oh, I think at first it wasn't. I said the first 2 weeks it was awful. I mean, I would come home and just ravage freaking food because I was starving, and would still eat the correct foods, but I would just, and now the balance that I have in my life is probably the most important, and yes, it's absolutely worth it. I mean, I have children, I have a wife, and I have young children, and it needed to change, and I might as well change it at 40.
Well, and the great thing about that is, A, you have great partner and teammates that supported you.
Right.
And B, what you're doing now is also helping your children, and
right.
They will see this.
Right.
So, well, Gabe, I would like to thank you and welcome you and just appreciate the work you've done and congratulate you. So, have a great day, great weekend.